Welcome to the Beverly Hills Plastic Surgery Podcast. I'm here today with my most faithful co-host, Dr. J. Calvert. How are you?
I'm good. I'm ready to talk about
What are we talking about today?
Our fat loss topic. I'm wondering if I have this, but I think I do. I think I'm getting it.
I was almost going to introduce you
as Ozempic Faced. Because I'm on the juice, man. I am. I'm on the Wegovy.
That would just be mean, because that is the topic.
But I'm
today.
getting that.
You don't have Ozempic Face.
I kind of do.
You don't. Okay, so let's get into this. So
I think I do.
Literally get this question all the time. Like, can you comment on Ozempic Face? And it's a buzzword. It's out there in social media.
Totally.
It's in these news articles. Ozempic Face, so-and-so has Ozempic Face. And it drives me nuts because Ozempic Face literally is just a weight loss face.
It is.
And we see weight loss faces all the time. I see it all the time in my patients that have had surgical weight loss from bariatric surgery. It just means that you've lost the fat in your face because you've lost weight. And as a result, the skin is starting to sag and hang and age like the skin everywhere on your body hangs and sags with weight loss and age. So
Thank you.
we could finish the podcast now. Ozempic Face is basically just...
Well,
obviously,
what do we do about it?
We're not going to finish the podcast now.
I've got a lot to say about
this. It just means that it's a weight loss face, which you, my friend, do not have a weight loss face.
No, and I'm on Wegovy, which I haven't lost a lot of weight on it, which, I went on it because, my family history of diabetes is crazy. And at one of my labs, with my doctor, who's amazing, Dr. Eva Queenar, she found, my A1C was 5.9. Well, 5.8 is sort of the upper limits of normal, and you're starting to tip into like that pre-diabetic look.
Yeah.
And so she was like, you need to go on this based on your family history and where you are. She's like, you're not getting any younger, which I'm not. So I went on it, and I didn't lose a lot of weight on it. I don't think I lost any weight, quite honestly.
You lost a little weight.
You think so?
Yeah.
I mean, not by the scales, but maybe that's because I'm working out for the muscles.
No, that's not true.
Yeah, I think I lost maybe
you lost
8 or 9 pounds.
Yeah, no, you
10 pounds.
definitely did.
Are you saying I'm fat? Or I was fat?
No, I distinctly remember when you went on it, because you told me your weight, and then you told me a few months later how much you had lost, and it was a decent amount. See, you're like the plastic surgery patient that forgot what they were like.
It's true.
Before.
I am. I'm that guy.
You're like, I've always been this weight.
Well, now I'm down. I guess I'm 190.
You lost 20 pounds, I think.
Really?
Mm-hmm.
Boy, I was fat. Yeah. I mean, but I think I've also been working out very hard knowing that there's muscle loss with this situation. So,
right.
But with my face, I don't know. I don't think I look Ozempic faced.
You don't have Ozempic Face.
Yeah, it's like
weight loss face. You usually need to lose over 30, 40, certainly anything over 50 pounds. You're going to see this. And it can be in people of any age. Now, younger patients do fare a little better because they have younger, tighter skin. Their quality and their tone is better. So they are able to sort of snap back a little bit better. But once you're in your mid-30s and upward, when you lose weight in your face, the skin doesn't snap back very easily. And you can very easily put yourself in facelift category in your 30s if you lose this amount of weight.
I think so.
And it ages you. That's the thing, too.
It does.
When you are a little overweight and your face is plump, you do have more of a youthful, plump look to you. And then when you lose that fat and then your skin starts to sag, you can age pretty dramatically. So I will have women in their 30s, early 40s who kind of look like they're in their 50s. They just have aged. So there is sort of this balance between losing weight and getting healthy and looking older in your face.
Yep. I mean, I think you're right. And I think we've talked about facelifts in the weight loss patient and how they're different. And I think that, these drugs, the semaglutides and the trizepatides, they're definitely causing, weight loss for people, which is great.
Yeah.
And I know
large amounts of
my
weight
A1C
loss.
is, 5.2 2 or something now. It's like gotten better, and so I think they're kind of miracle drugs from that standpoint. I don't know, like, people are like, oh, what about the long-term side effects? I was like, dude, I'm not going to be alive that long. I mean, like, okay,
Also,
long-term.
what about the long-term side effects of diabetes
Yes.
and high blood pressure and obesity? Like, come on.
Yeah, I mean, I just had my pressure taken recently at a doctor's office, and it was like, even with my white coat hypertension I get every time, it was like 128 or over like 82. It was good, and that's better than usual. But you have to understand that, like, these diabetes is like, it's so misunderstood by the public. They don't understand how bad it really is.
It's bad.
It's basically, that you are sugar coating all the functional proteins, organs, blood vessels,
Nerves.
the nerves, your eyeballs, like everything is getting sugar coated so it doesn't work.
And like not in a good way, sugar coated.
No, not in like a, oh, this is tasty way.
No.
In a way that it's like
sticky sweet, bad.
Yeah, it's like getting like rust on all of your proteins that do things in your body. And diabetes is a terrible disease.
But the problem is, it's so commonplace that I think people think of it as just like, well, everybody has the sugars.
That's something that happens.
It's like, it's what you have. Or like a little bit of high blood pressure. Everybody has a little bit of high blood pressure. Everybody's a little overweight. Like, just because we're all overweight and have diabetes doesn't mean that's how we're supposed to be.
No.
And if we can fix it and these drugs work and you can tolerate them, then I think they're great. But that's not the point. The point isn't to talk about the drugs because I don't prescribe them. I'm not a prescriber, so I don't want to comment out of turn on them. But what I can comment on are their effects. And so basically, Ozempic Face is weight loss face. And let's talk about how we treat a weight loss face. Although, quick side note, because again, we get all these requests for comments. Oh, talk about Ozempic Face. You know what I got the other day? Need a practitioner to comment on Ozempic Feet. And I literally lost it. I was like, oh my gosh, you want me to comment on why someone went from having fat feet to skinny feet? Like, is this a thing, people? Their feet are just skinny.
There's like a foot pick thing on the internet that's I know.
Don't know. But like,
I'm just saying.
An Ozempic foot is just a not fat foot. It's just a skinny foot, and you can see the bones, and it has skin, and it's a skinny foot. Like, period, end of story, next.
Maybe you're going to do some fat grafting.
Maybe that's what I need to do for these feet. Maybe they go down a shoe size. I don't know. But everything related to Ozempic, it's not like some magic thing that's happening. It's just mostly weight loss.
Well, what do you do to treat it?
That's the
big question. So it depends whether it's a skin issue or a volume issue. And
usually it's both.
Usually it's both. And so like doing, facelifts of various kinds, doing, it depends how bad the skin issue is, because some fat grafting goes a long way in people who've lost a lot of weight.
In a young patient with good skin quality that doesn't need a lot of tightening per se, I think filling up the volume is very helpful. And that can be done with good old-fashioned fat grafting, taking some fat, injecting it right back into the face. It can be done with things like Sculptra. It can be done with things like Renuva.
Sculptra? What's that, Dr. Rovelo?
Sculptra.
And we have no financial interest.
Zero financial interest.
No, I wish I did, because then may I get some payment on this stuff, but we don't. No. And Sculptra, why not sponsor the podcast? Why not? We're right here.
Putting it out there.
Just putting it out there. Give us a call. But Sculptra, which is a injectable filler, basically. Filler growth.
Ish.
Yeah, it's a stimulator of collagen and soft tissue growth.
Yeah. It doesn't give you volume right away like a synthetic filler does, but it stimulates your body to make collagen.
And in fact, Sculptra, which is poly-L-lactic acid, right? So it is it's a polymer plastic, basically, that's absorbable. It breaks down into lactic acid, which, you get too much of when you work out too hard and your muscles hurt. That's lactic acid. So it's a very natural substance that it breaks down to. But in its polymer form, it stimulates the soft tissue to grow and makes collagen and soft tissue, extracellular matrix proteins that causes things to volumize. And it was really discovered back in like the 90s when, first we had a lot of the reverse transcriptase inhibitors that were coming out to treat HIV. And the downside of those was people were losing fat in a lot of places and growing fat in a lot of places too. But it was mostly for facial wasting, and the Sculptra was very effective in treating that.
The faces would get very, very thin and gaunt. And actually, Sculptra had like insurance, medical approval and authorization to treat
and it works great.
These kind of atrophy cases. But now we use it for a variety of things, including loss of volume and Ozempic Face, just to get some volume back. Renuva is similar to Sculptra, but instead of building collagen, it asks or has your body build fat. It's like a matrix that your body puts fat on. So it's another way of volumizing the face sort of naturally. All these things can add volume to a face that has lost it, assuming, again, that the skin quality is good. If the skin quality is not good or it is loose, then you do need to go on to some kind of formal facelift. Depending on the quality of the skin and the age of the patient, they may be candidates for some kind of non-invasive strategy for skin tightening. So this would be something like a face type procedure, Renuvion, Morpheus, even the dreaded thread lifts like we talked about. But again, you have to have really good tight skin that can respond to these treatments. Because you can do the treatments, but if the skin doesn't have enough elastin fibers to actually like contract and become tighter, then they're not going to work. So that is an option. But a lot of times, even in the younger patients, they don't have the great skin quality, and they are looking at more of a traditional facelift.
Yeah, and it works.
It works.
You know, so this is
great.
you're gonna look great. But yeah, I mean, these are the things that you have to kind of consider. And the best way to figure it out is go get a consultation with a board-certified plastic surgeon who can help you with it.
Yeah, they'll tell
Period.
you
End of story.
exactly where you are on the spectrum and what you may need. But it's definitely something that I see a lot of, both in the bariatric patients and in the medical weight loss patients, that they just look older. They look a little bit more wasted in the face, meaning they've lost the volume, and just sort of more tired and aged looking.
But worth it.
But worth it.
The weight loss is worth it, and the diabetes control
is so worth it.
So
yeah,
you just have to kind of deal with it. That's why you have your friendly neighborhood plastic surgeon who can help you out.
Right here. Anything else you want to add, Doctor, to Ozempic Face?
No, I just hope I don't.
You don't have
wind up
Ozempic Face.
in
I
the
promise.
category.
You don't.
All right. Well, I'm happy to hear that. So
You might have Ozempic feet. I haven't checked them recently, but not a face.
I haven't checked them recently either. So
Well, in that case, this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.